Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
which of the following antihypertensive drugs does not alter the serum glucose and lipid levels? In the given antihypertensive drugs, propranolol will increase the LDL levels and also increase the triglycerides. Prazosin will thiazide diuretics will cause hypoglycemia. Prazosin will not alter much. Actually, it has better effect on lipid levels. Next. Which of the following is not useful for hypertensive emergency? We can use sodium nifedipine. Nitroprusside can be used. Whereas indapamide is actually a thiazide diuretics. Thiazide-like diuretics. And this indapamide has only mild diuretic action. Because of its mild diuretic action, it is not used in hypertensive emergencies.
thank you and thank you for watching.